Hello everyone, Sonia Liebendorfer here, and I am going to be covering today the hereditary type of amyloidosis that is actually caused by a genetic mutation and is passed down through families. So this particular type is important, and it's important for you to know the kind of things to look for in loved ones that may have this because it runs in families, and not all families are symptomatic, and we're going to go into that. So let's go ahead and get started. All right, now this particular type of amyloidosis is caused by the TTR protein, which is a transport protein, and it can be found in the blood, and it's also found in the cerebrospinal fluid, which is the fluid that surrounds the brain. Now, we've talked about in various cases about quote unquote housekeeping problems that your body has as it gets older. This particular problem is hereditary. It is an autosomal dominant genetic mutation. That means there is a defective genetic code passed down from one or both parents down the family line. Now, there are two problems that are associated with this. One of them is familial amyloid neuropathy, and a sign of that is usually carpal tunnel early in life. When people start having carpal tunnel early in life, and it's not from repetitive motion from working in a manufacturing type job or something in which they have repetitive use of their wrists all the time that would be causing the problem, then this is a concern. The other thing is there can also be familial amyloid cardiomyopathy. And we're going to go into that as well later on when we start looking about all the different heart problems that can evolve from this particular type of amyloidosis. All right, so let's look at this transthyretin, this TTR. Let's look at it and see what it does. This is a picture of it, but you see it has two main functions that it does. It provides the T4 hormone, which is a thyroid hormone called thyroxine, and it also transports retinol binding proteins that are bound to retinol, which is vitamin A, as its secondary function. Now you see down at the bottom, I took the trans from transport, the thy from thyroxine, and the retin from retinol, and I combined them for you to show you exactly how they came up with this particular name for this type of amyloidosis. Now the A in the ATTR, the A stands for amyloid. So this is the particular type that is caused by this TTR buildup of protein. And what happens is the genetic code causes these proteins to be misformed. Now remember, we talked about in other medical conditions how something triggers this and makes it not work. In this particular case, this is genetic. This is passed down through families. And so what happens is you usually will see somebody will recognize that there is a pattern when it comes to family members and illness, and there is a pattern with certain conditions developing through the years. So whenever that happens and somebody picks up on it, that's the way they know to test for it, because otherwise they don't know. So it's very important that if you notice a specific illness or type of illness that runs in your family, to explore that further, because it may be a related condition due to something like this. So we're going to go into this today because I'm going to go into the different signs and symptoms and the different causes and the way that people present with this. I'm not going to go into the treatments and all that because it will make it entirely too long, but I want you to have an understanding so you can put the pieces of the puzzle together. If you have a loved one that has these symptoms, you can recognize, hey, I need to have them tested for this because my family members such and such and such and such also had this. So it's important to be able to pick it up. Otherwise, it can keep going undiagnosed from generation to generation, and people are suffering needlessly. So this is why I want you to understand what all is involved with it. So if your family members do have it, you can have them tested. All right, so how does TTR get in the blood? Well, it gets in the blood via the liver. And it gets into the cerebrospinal fluid of the brain via the choroid plexus, which actually secretes that fluid. Now, another name for it, for people that are old school and been around a while in the medical field and been around and are familiar with medical terms, you may have heard this called prealbumin before in lab work. But what causes this problem is the misfolding and then aggregation, a collection of these misfolded proteins cause all kinds of problems for families. Now, there are different types, different genetic types. One is the polyneuropathy, which I told you kind of starts out with carpal tunnel problems when they're young, and then problems just get added on to that later on as they start to present themselves when these proteins start depositing in other areas. There's also something called senile systemic amyloidosis, and that is when it shows up when they're elderly. Otherwise, you don't see any symptoms for years. And then there's one that's called familial amyloid cardiomyopathy, and that's the one that shows up as different types of heart problems in families. So we're going to be talking about all of these different types, but this is just going to be a general overview because I want you to tell you what you can look out for as far as symptomatic problems with your family members. So it can cue you that, hey, we've had numerous family members that have had this same medical condition, so maybe this is something that needs to be checked out because they only recently started really digging into all of this to explore all this. I never even heard this term mentioned until a nursing conference earlier this year. And the only reason we heard about it is because the pharmaceutical companies now are trying to push drugs about this stuff. If they weren't trying to push a drug for it, I can assure you we probably still would not have heard of it. But that seems to be the only way that we learn about things is after the fact, after Big Pharma gets involved and wants to push a drug for it. So that whole process is just skewed, in my opinion. Why don't we do the exploration and learn about things beforehand to prevent problems later on? Because if this is preventable and we can find out what the cause is of the gene mutation, wouldn't it be fabulous not to have family members down the line have this genetic mutation and have to deal with the problems? It would be great to not have to have them deal with it. So that's why this is so important for you to know what to look for. Now, because this particular type of amyloidosis is caused by TTR, there are some people that will carry this genetic mutation that will not have symptoms at all, but yet they'll pass them on to a family member later on that'll have problems. Then there are other people that are carriers of the genetic mutation, that'll just have a few minor health issues. They might get diagnosed with carpal tunnel when they're younger. And you have to be concerned because if it's a person in your family that's not working like a manufacturing job or they're doing a repetitive motion over and over and over and over, which is what triggers carpal tunnel, then their carpal tunnel may be caused by these deposits in the carpal tunnel sheaths at their wrists, causing the problem. Now, there are two different types of familial amyloidosis. This ATTR type, but there's also a non-TTR type. We're not going to cover that one today. We're just going to focus on what to look for with someone who may have this ATTR, because this is one of the most common types when it comes to hereditary and genetic problems. Okay, so what are some of the organs we're going to see involved in this type of amyloidosis that we can look for things to look for in our family members so we can get them tested? The first thing, if you have a person that's having problems with their kidneys, they're not urinating as much anymore, you notice they have some swelling in the ankles. Of course, we talked in the past that the swelling in the ankles can be if they're losing more protein than what they have in their blood, or if they've got proteins that are so large that they can't pass them anymore, it can set them up for renal failure and they'll have to go on dialysis. We also talked about the fact that you can drop off the amount of urine that you're putting out and get to where you're not putting out any because of the size of the proteins, and it blocks the kidneys being able to do their job and filter out all of the toxins in the body and get rid of them. So you can see that, or they can be complaining of dizziness. They can be complaining of frequent urinary tract infections. Now, something very simple that can take care of a problem with urinary tract infections, if you have somebody that gets them a lot, it's usually either a hygiene issue or because they're wiping from, if they're a female and they're wiping from back to front, that can be the problem. Or it can be a problem of the pH of the urine, because as we get older, our pH gets higher, creating a more productive environment for bacteria to proliferate and grow. So they like to have the less acidity. So one of my doctors years ago, a urologist that my mother went to, she was having problems with crystals in her urine that were predisposed her to kidney stones. His solution was very simple. He said, if you have problems with the acidity in your urine, you have problems with the formation of crystals, or you have problems with frequent urinary tract infections, frequent problems with pain in the kidney due to formation of these type crystals, then it is best to cleanse out the kidneys with 1 glass of cranberry juice a day. Now, if you don't like cranberry juice, I can understand that because it can be kind of like a bitter taste. But if you get it with something that's mixed with either cherry juice or get it mixed with apple juice, I like the cran apple, that use is just as good. And the apple is always good to help you with the gut health too, because it helps move things along. But be mindful of urinary tract infections. Sexual dysfunction. If a man is complaining that he has erectile dysfunction, this can be one of the problems. If people are sweating abnormally when they shouldn't be sweating, if it's cold outside and they're working up a sweat, this might be a nervous system issue. Carpal tunnel syndrome they have listed there. Glaucoma is another one. If they start to have problems with halos around the lights and stuff, it can be glaucoma. Dark floaters, if they start thinking that they're seeing mosquitoes and stuff and it's not really there, then it might be floaters in the eyes giving them difficulty. And that is common with aging anyway. But I want you to be aware that if it starts really developing into a problem that is affecting quality of life, that's when we worry about it. Abnormal blood vessels in the eye. If you're having abnormalities with the blood vessels in the eye, when you go to the optometrist, he's going to tell you things are abnormal. Eyelid swelling and inflammation. If you have a problem with that and didn't have a problem with it before, there may be something going on. Now, as far as irregular heartbeat and heart failure, these are some of the classic signs associated with the cardiomyopathy. One of the main things that presents is atrial fibrillation, which is when the heart just sits there and quivers like a bowl full of jelly because there's no rhyme or reason to the rhythm. And heart failure sets up with that because of the stress of the heart in trying to beat normally, even though that it cannot, because the actual pacemaker of the heart is messed up. So that's what happens with this, is the pacemaker of the heart can get messed up with the cardiomyopathy. Now, they can have some symptoms with nausea with that and with the dizziness, so those have to be investigated. They can have problems with vomiting if the nausea gets bad enough. They can have a loss of appetite due to bloating, feeling full after they eat, which can involve having problems going to sleep if they have that discomfort going to bed. And it can cause diarrhea and constipation because it can affect how well they can actually digest their food and get the benefit from it. And the wasting of muscles and tissues are usually due to a lack of appetite. They quit eating because either they feel full even though they haven't taken much in, or their body is just not absorbing the nutrients from the food that they're eating because they're not getting enough of it, and it's throwing it off either too fast and not allowing them to get the nutrients out of it, or they are getting extremely dehydrated from not having enough oral intake from the discomfort. So those are all concerns and issues that are related to this. Now, the concern comes with the nerve pain because it starts in the extremities, in the fingertips and in the toes, and it works its way up the body until you start developing the main problems with either heart rate or the difficulties with the breathing, or if somebody is getting short of breath on exertion. All of those type things can start to develop, and we're going to go into that a little bit more in just a few minutes. What you need to know is, so far, they know that there are 136 different types of genetic mutation variations with this genetic code mutation. Every family is different. They have their own pattern of organ involvement. They have their own age of onset of symptoms. They have their own symptoms, and they have their own progression. There is no actual pattern to this that can be identified. And the concerning thing is, as they do more research regarding this, they're thinking they're going to find even more genetic variations as people are willing to participate in the studies associated with the illness. So that is something that is really interesting, is that there are that many genetic variations involved with this. Now, you will remember we talked about that TTR is made in the liver and that this is caused by misfolded proteins. And there is a genetic predisposition as to what age and what organs and nerves are affected by this per family. It's all different in everybody. But the main two types that we're going to talk about now are the familial amyloid polyneuropathy, which is FAP, and the familial amyloid cardiomyopathy. We're going to go into more in depth about both of those, okay? All right, we talked about that this is usually found whenever a member of the family starts to notice that they're family members through the generations that have all gotten sick with the same type of illness. Now, in the case of my mother and her mother, they both developed atrial fibrillation in their 80s. Now, a lot of people get AFib once they get into their 80s. I don't know if this is a family thing with us, but I do know I have been diagnosed with carpal tunnel. I do know that I have glaucoma. Even though I think all of my problems stem from a systemic response to my hip implant that I had put in 2017, it's not going to hurt anything to have them explore this and see if maybe this is a family hereditary problem that is being passed down through the generations. Because for my mother's mother to have it, and now her to have it, both of them AFib, both of them heart failure, it's just very unusual for that kind of thing to happen unless it's not being genetically driven somehow. And if I'm predisposed to that, I'd rather know now. Because when I got diagnosed with the glaucoma earlier this year, and I also got diagnosed with the carpal tunnel, after a nerve study, I was like, something's amiss here. Something is just not right. And then when they started presenting this information in the presentation that I was listening to earlier this year, Big Pharma was talking about all the drugs and everything they're coming out for it. I was like, why have we never heard of this? Why is this new? Why haven't we done anything about this before now? Because they haven't looked for a way to make money off of it before now. That's why. But if we can determine that our family members have this, and if there is a way that we can look at what causes the gene mutation and how to prevent it from happening, we can save our family members from this later on. So it's worth learning about it and knowing what to look for. Now, whenever it starts out with the polyneuropathy, and it can start with carpal tunnel, if they don't work in a manufacturing job where they may have a problem with repetitive motion injury, if they are just complaining about working on something and all of a sudden their hands go numb, then it can be a problem with carpal tunnel. If they develop a problem like I had, where they can't hold on to anything, they have the dropsies, because they drop everything, they can't hold on to it, then it might be a carpal tunnel problem. If they are seeing halos around lights, then that can be a sign of glaucoma. That's how I knew I had a problem. I started seeing the cloudy halos around the lights. And then in addition to that, I started having problems with ocular migraines that I never had before. And I was like, why is this happening? And it's what prompted me to go to the ophthalmologist, because I had actually not been to one because mine retired a couple years ago, which wasn't wise, But until I had a problem, I wasn't concerned. But then what do? I go to the doctor and find out, oh, you've got glaucoma in both eyes. What? So it's important because all these things may come together for me. I don't know yet. We're still doing all the testing with my mother right at this point. But if you have a family member that starts having problems with their kidneys, they're not going to the restroom as much, complaining of inability to get it up, not voiding as much, complaining of voiding a lot less, not even having the urge to go. How about incontinence? Complaining of not being able to hold it long enough to get to the bathroom. Dizziness, complaints of heart palpitations, and shortness of breath on exertion are associated with the autonomic nervous system. It can have to do with rate problems. It can have to do with their GI discomfort. If they have problems with diarrhea, it may stimulate them that they have to go right away and they can't hold on to their food. I mean, it causes all kinds of problems once it starts affecting the nervous system. So these are things that you're going to have to look for and to take consideration if you start seeing these things in your family members. And if they have a history of them, down through the ages, there may be a genetic problem that needs to be tested for. So these proteins build up in the organs and start causing issues, and your family member starts complaining of nausea or complaining of weight loss because they feel bloated and everything after they eat, so they don't eat that much. They're eating like a bird. They're not really taking enough in for their nutritional needs. Or they start having an inability to sleep because they feel bloated after they eat something to the point that they're so uncomfortable that things aren't moving along that they can't sleep. Then they get problems with increase in fatigue. That can be a problem. If they get tired very easily, it could be because of shortness of breath on exertion. And that can be a sign of heart failure, but it can also be a sign of fluid backing up because they don't have enough protein in their blood and they got more protein in their kidneys leaving in their urine than they do floating around in their bloodstream, and that's not good. So there's many things to look at with this, and we're going to go over some other areas of concern, some more symptoms that they might complain of, because these are things that you need to look for. So we talked about the leg swelling and the edema, which could be heart failure related, but it could also be related to the kidneys not functioning properly. The complaints of palpitations, I feel like my heart is racing. Or you take them to the doctor and they do an EKG tracing and find out that they have abnormal heart rhythm, such as atrial fibrillation, AFib. They complain of chest pain that doesn't last very long, but they know it's there. Every so often it hits them really hard and it really hurts. But they don't tell you in a timely fashion so you can get them to the doctor because they really don't want to go. And they can have complaints of diarrhea. If it's an autonomic nervous system thing, their gut could just be triggered to empty without even given them the time to benefit from the nutrition that they took in. Or they can have problems with constipation, especially if it's affecting their thyroid conditions, and constipation and dry skin and dry hair. All of that goes hand in hand. Can't get warm. All of those things go hand in hand. So if you have those kind of symptoms, please get your thyroid checked, because it can really lead to bad problems if you let it go without getting it checked. Bladder control issues they'll be complaining of as well. My mom started saying all of a sudden she needs pads because she's having problems with incontinence. And I'm like, okay, well, this is a new thing. So all of this whole picture together, once they started going over this information, I had it tucked back in my mind until she started having problems with the AFib and the dizziness and the diarrhea and the urinary incontinence. I mean, all this came on at one time, and I'm like, could she have this this ATTR? I mean, I don't know. She could have the senile version. I don't know. So, it's all just a bunch of tests right now, which is why it's taken me so long to get on this week. It's because I've been taking her for testing, and we've got more tests later this week, and then we've got our follow-up next month. So they wanted to do a nuclear stress test on her, and I told them no, because she was so anxious from just wearing a heart monitor for 24 hours that she did not sleep at all. And I said, I'm not putting her through the discomfort of having drugs given to her to change her heart rhythm to see how fast it changes and how it affects everything needlessly at 83 years old, just to determine if there is a issue with the rhythm of her heart, because we already know there's an issue. So I'm not putting her through that test. I told them I'm not putting her through that. We will just go with the information they have from the heart monitor and from the echocardiogram, the sonar imaging they did of her heart. We'll go over that next month, but I'm not putting her through a stress test. She cannot walk well enough to do a treadmill test, and it's just not worth it to me to put her through the stress of having a challenge like that with drugs to see how her heart affects with different medications, speeding it up and slowing it down. It's just not worth it to me to put her through that. Not when she had so much duress over just wearing a Holter monitor and stressing herself out over, are they going to come off while I'm sleeping? Or why is this thing beeping, but it's not beeping regularly? And she would see the light go off and things of that sort. And it just caused her too much worry. So it wasn't worth it for me to do that stress test, but we're doing everything else. So just keep this in mind, because congestive heart failure and AFib are the most common symptoms associated with this particular familial type. So just be aware if you start to see symptoms in your family members that you get them checked, especially if you've had other family members that have been diagnosed with the same condition, because that's like a red flag that, hey, there may be a family predisposition to this problem. We might want to get it checked out. All right, so your family member starts complaining on what are these problems. Well, what are the doctors are going to do? Well, I've done this for so many years, I can pretty much tell you what they're going to do. So we're going to cover it really quick. If they're complaining of kidney problems, the first thing they're going to do is get a urinalysis from them, do a dipstick test, see if they have excessive protein spilling in their urine. If they have the excessive protein spilling in their urine, then they're going to do a 24-hour collection. And I've told you before how they can elect to do this in the hospital, or they can have you just collect it all at home. Depends on how well they trust you about collecting all that urine as to which way they do it, or what the facility's policy is and what insurance is going to pay. Of course, that's always an issue. They also, you want to be mindful that this is recognized pretty quickly, because it can cause them to end up on dialysis if it's not caught in time. So you want to catch this problem early if there's anything going on with the kidneys. If they have any new complaints of incontinence that they haven't had before, I just can't make it to the bathroom anymore. Can you buy me some pads? If they're having that kind of problem, then you might want to be concerned, especially if there's other people farther on down the line that have had the same problem. That's usually one of the first signs that things are going amiss, is problems with the kidneys. But all families are different. So, and some people don't have kidney issues at all, or they show up later on down the line and it's not the first thing. So we're going to go into some other things to look for. All right. So what if your family member starts telling you that they just all of a sudden are having problems with nausea? They don't feel like eating. Or they feel bloated after they eat, or they feel like that they have got so much gas or whatever that they just have so much discomfort they can't go to sleep at night. They have problems with constipation. They just can't get things moving along. And that can be caused by a nerve problem too. If they have problems with it not getting stimulated enough at all to move things along, that can be an issue, as well as diarrhea, getting stimulated too much to go ahead and empty. They can have the reverse problem. The body's not telling them to empty. So, unexplained weight loss, we covered that, why that could happen. What the doctor will normally do is they'll do either an endoscopy or a scope of the upper GI tract. They can either do a barium swallow, or they can do what's called a EGD. And the EGD is when they scope and go down to the stomach and they're looking for any sources of ulcers to hiatal hernia to polyps, anything abnormal that's going to cause GI problems. They can also go in from the other end and do a colonoscopy and look and see if there's any causes for the constipation and the diarrhea, especially if they do what's called a fecal occult test and they see blood. If they do a fecal occult test, they're going to basically stick the finger up the rectum. They're going to put a smear on a card. They're going to put some developer on it, see if it turns blue. If it turns blue, that means there's blood present. So they need to find out why there's blood present. Is their blood, are they bleeding from the upper part of the GI tract, or are they bleeding from the lower part? If they're bleeding from the upper part, remember we said if you're bleeding from the upper part, it's going to be dark red, like a maroon color. If the bleeding is farther along down the GI tract, the closer it gets to the out, it's going to be a brighter red. And those are often affiliated with either hemorrhoids or some type of tear, especially if you're straining to go to the bathroom. Now, if they don't find anything in any of those tests that might be the problem, then they might want to do a CAT scan and check the abdomen and the pelvis for problems. And they usually do it with and without contrast. The reason they do it with and without is it saves them a second trip. If they don't see anything without contrast, then they normally give it with the contrast. Now, what is the difference? They can give it with oral contrast, in which they have you drink this stuff that's going to make everything light up like a Christmas tree, but you have to drink a cup of it, and you have to drink a cup every 30 minutes. You have to drink 3 of those cups. So it takes you like an hour and a half to get all that contrast through your system before and then after that last cup, after 30 minutes after that last cup, they'll call and say, hey, you can bring them up. So you'll have to sit through all that process of letting it go through your system, and it's a time-consuming process. But that at least they've made that contrast media where it doesn't taste as bad as it used to. My patients used to always complain about how horrible that stuff tasted. But they've actually got it to where you can't taste it anymore. It's just like ice water. For kids, for young adults, I used to add a little bit of Gatorade just to give it something to taste a little better than just contrast. But there's really, without the contrast orally, sometimes they might elect to do the IV. Now, what the IV contrast is going to do is it's going to show more about the blood vessels. It's going to show more about the tissues themselves, if there's any abnormalities, such as a mass or tumor or anything like that has extra vasculature. That's going to light up like a Christmas bulb on the scan, and they will immediately see if there's any kind of problem causing an issue. So these are the kinds of tests that can be expected for those kind of issues if your family member has that type of complaint. Now, if you have a family member that's complaining of dizziness and they're up in age and they're complaining of nausea, those kind of complaints in the elderly really need to be explored because it usually has something to do with three things. Something is going amiss with the heart, something is going amiss with the blood pressure, or something is causing inner ear trouble. Now, the dizziness that's related to the inner ear is easier to pick up on because it's usually involved in change of position. You'll hear a complaint of the room is spinning when they go from laying down to sitting up. If you hear a complaint of the room spinning, then it's more inner ear in nature. However, if they are complaining of dizziness and nausea, it's something that you really need to look into. Another thing is they can have that complaint if they're dehydrated or if they're undernourished. But if you know that they're not having that particular problem is not an issue, then you need to be concerned that something is either going on with the heart or with the blood pressure with that person. Now, they can complain of palpitations. They can complain of intermittent, brief episodes of chest pain. They can, you may notice swelling in their legs, but you can also notice swelling in the abdomen. Now, I want to talk about this because there's two different kinds of heart failure. There's left-sided and right-sided. I've done presentations on these two different types, but I have them included in the reference section for this if you're interested in going and reviewing them, because with the left-sided heart failure, it is when the left ventricle is expanded, so they don't have that support to really push that blood out and get it to where it needs to be. So you're going to see things back up in terms of the ankles and the swelling in the feet and stuff. They're going to be short of breath on exertion. They're not going to be able to get their breath back really quickly. They're going to have to sit there for a couple of minutes before they get to where they're not so winded when they do the least little bitty thing. Another thing is the right-sided heart failure. Now, the right-sided heart failure is usually breathing driven. You see it more in people that have problems with COPD. You also see it more in people that have complaints of swelling of the abdomen, and it's because all of the fluid on that right side of the heart backs up into that cavity there in the abdomen and in the chest. And when all of that fluid backs up into the lungs and everything, it causes issues with breathing. So they're going to get very short of breath, but instead of having the fluid swelling on their legs from being left-sided heart failure, they're going to have it in the abdomen from it being right-sided heart failure. So I hope you understand that brief explanation. But I'm going to reference the two videos that I did on heart failure at the end of this, so you'll have a better idea about heart failure. All right. I want to thank you for being here. I know you've got many things that you could be doing, but I appreciate you being here and spending some time today as I covered this. I hope you learned something from the presentation. If you did, please hit the like and the subscribe for the video and let me know that you learned something, because this is how I know whether or not I'm doing a good job as far as content in getting you to learn something from the information that I provide. And I want to give a special thanks to the Amyloidosis Foundation and Wikipedia. They have fantastic pictures and valuable content that they provide so that patients and their families can get a better understanding of this condition. So I'm going to be covering the treatments and all of that, as well as the non-TTR in a different presentation. I'll either be doing it this weekend or early next week, but I've got more doctor's appointments that I have got to have addressed later this week. So I may not get to it by this weekend, but I will do my best to either get it posted this weekend or at the latest early next week, depending on how busy the doctor's offices are. So y'all have a wonderful day, and thank you again for being here. And I will have some more information for you on this shortly, and I hope you learned something. Bye.